fingertips through our page. We have quizzes, competitions, research posts going up, which is very interesting to all participants. So it's like a collaboration of clinical skills, your rote learning, as well as non-acad stuff as well, which makes it so much more interesting for everyone. Plus, the membership is free. So if anyone would like to join, please do consider it. And introducing Ma'am, who is the speaker for today's session. Ma'am hails from a small town of Pathankot without any medical background, but she's still here, thriving as an amazing professor with over a decade of teaching. She joined CMC Coimbatore and was very influenced to take up pathology, after which she chose pathology and joined LHMC in New Delhi. She was an assistant professor for Path at UCMS Delhi. She also worked as a senior research associate at AIMS New Delhi and is currently working as a professor at LHMC and is associated with Doc Tutorials. Thank you so much, ma'am, for joining us today. All of our questions are related to NEET PG preparation or FMG preparation and how to deal with pathology. And considering NEET PG is so close to us right now, I'm pretty sure this would be an amazing session. So can we begin, or is there something you'd like to say to the students?
Hello everyone. First, thank you for joining and thank you Clinical Evolve for inviting me today. Thank you so much. So I think basically no dream should be small. So I recently saw a movie 12th Fail, isn't it? I'm so motivated by it. And I also heard a recent interview, the interview says that if you have a desire, ठीक है, अगर तुम्हें कुछ करने की इच्छा है तो तुम कहीं से भी वहां पहुंच जाओगे जहां तुम पहुंचना चाहते हो. ठीक है, you will reach there. It's destiny. Whole world, whole universe conspires to make you reach where you wish to reach. So इसीलिए कभी इस सिचुएशन से नहीं डरना चाहिए कि मेरे से नहीं होगा. अगर तुम चाहते हो तो तुमसे जरूर होगा. आई स्टिल रिमेम्बर दैट मैं बहुत छोटे शहर से हूँ, मैं पठानकोट से हूँ. और मेरे घर में मतलब बेसिकली जब मुझे मेरे घर में किसी को ये भी नहीं पता था कि कुछ एग्जाम देना होता है डॉक्टर बनने के लिए, तो मेरे डैड बोला करते थे कि ऐसा करो तुम बीए कर लेना फिर तुम्हारी शादी कर देंगे. एंड आई वाज लाइक पापा व्हाट इज दिस, नो मतलब व्हाई दिस. So नहीं, मुझे I will my home, my nickname is Twinkle. मेरे घर में मुझे सब प्यार से ट्विंकल कहते हैं. सो आई यूज्ड टू से टू माय पेरेंट्स कि आपने मेरा नाम ट्विंकल रखा है तो कुछ सोच के रखा होगा ना. आई विल आई ट्विंकल इन द स्काई. So basically when I started, it was a very tough journey. हमारे यहाँ मतलब no, there were very few people who used to prepare and study dedicatedly, और मेरे घर में ऐसा environment भी नहीं था. So but looking at my journey throughout, I can very confidently say that nothing in this world is impossible. So with that, yes, now you can start.
Thank you so much, ma'am. That was really helpful. The first question that we have is someone is saying they're taking their drop year. So they want to know how can they utilize their drop year efficiently, and also how can they keep on the lookout for branches, like which branch they should finalize on basically. So maybe you can share how you chose patho, and that can help them decide perhaps.
देखो यार, फर्स्ट थिंग आई वुड लाइक टू से कि अगर आप ड्रॉप ईयर ले रहे हो है ना, तो ड्रॉप ईयर को बहुत सीरियसली लेना. ठीक है, दैट इज वन थिंग आई विल से. लेकिन बाहर वालों के लिए अपने कान बंद रखना. ठीक है, सो जब आप ड्रॉप ईयर लेते हो तो देयर विल बी लॉट ऑफ पीपल हु विल बी कमेंटिंग ऑन यू. ठीक है, क्यों किया, कुछ भी ले लेता, पागल है क्या, क्यों रिपीट किया. देयर विल बी लॉट ऑफ पीपल हु विल बी सेइंग मेनी थिंग्स व्हिच आर अगेंस्ट यू बेसिकली, कि ऐसा मत करो, ऐसा क्यों कर रहे हो. So close your ears. Don't listen to them. But be honest to yourself. You think मैंने ड्रॉप किया है, I have to be very honest to me. ठीक है, मुझे. So once you have dropped, so I'm sorry, somebody commented, please speak in English. I will speak in English. I'm so sorry. So once you've dropped, you should be. What I said was that if you've dropped, close your ears. Okay, close your ears, because there will be a lot of people who will be commenting on why did you drop, you are not efficient, you're not able to do, what if you fail, your parents, your relatives, your everybody around you will start judging you. So close your ears, okay, don't listen to them, but be honest to yourself. Say to you that I have dropped and I have to make every moment count. So make a strategy for yourself, okay? And what should be the strategy? The strategy should be divide your day, okay? Make first analyze, are you a early waker or you are a late sleeper? First decide that, okay? Then make a schedule that, okay, make a realistic schedule. Okay, I will wake up at, if you wake late at night, I will wake up at 8:30 a.m. and from 8:30 a.m. to 12:30 I am going to study without any distractions. I'm just going to study. Then I will take a break, 1 hour break, 1.5 hour break, and then I'll take a nap, I'll get up, and then I'll start doing my MCQs. So you have to give equal time to study as well as MCQs, and give lots and lots and lots of GTs. Why you have to give GTs is, so because if you give GTs, you actually know where are you going wrong. Okay, so in one question you might be confused between two options. Okay, so that doesn't mean that it was your bad luck, so you chose the wrong option. No, that means the concept for that question is not fully developed in you. So make a GT notebook, write your mistakes, and revise that GT notebook at least 1 week before the exam, and that's done. So that's how I think you should you should plan your drop year. So be very sincere to yourself and ignore everybody else. So that's what
Okay.
I feel.
Okay. Ma'am, since you mentioned GT, the next question is about GT, that GT scores are stuck, or that GT scores are not improving. So what would you say? How should someone proceed with that, especially so close to the examination? What should they change about their strategy?
So this is one of the questions which I am getting every year by year by year by year. Everybody keeps asking this question. So you know what happens? Okay. So first, you should know what is the strategy of a person who's putting GT. If I have been asked to make a GT for students, I will try to make 60% questions, okay, which will be above average, and 40% questions which will be much, much above average. Okay, so that my GT should be very effective. If you give my GT, you should feel that, okay, मुझे ये नहीं आता था. You should be able to realize that these are my weak points. So GTs are made in such a way that it helps you to emphasize on your weaker points. Okay. Now, when you start giving GT, okay, so the point is you have to see your scores overall. Okay, when you see your score and you find that, okay, I like you giving it for the first time, you find you score that, okay, my score is this and these are my weak areas. So analyze your weak areas, revise that topic, and make a GT notebook. Okay, next time you keep on giving the GTs again and again and again. If your GT scores are still not improving, that means either you are not reviewing your points correctly, number one, or you are not doing GTs as seriously as you should give. Okay, so again I'll give you an example of 12th fail movie, right? So do you remember how confident he was? No, I will do very good in exam. Then he goes to that IS officers and he says, okay, write an essay on your name. Okay, but the thing is that you have to do it in 30 minutes or whatever time point it is. He was not able to do. So that means, so same is with GTs. GTs should be done as seriously as you do as main exam, and you should finish it within time. So you should have a strategy in your mind. See, I've seen students getting fatigued over a period of 3 hours. They say, "Ma'am, I do very well in the first 1 hour, but when I'm seeing the question again and again and again, and I don't know the question, I start losing on the time. And by the end of the GT or by the end of the exam, what will you do is that you will start doing questions haphazardly, and you will start doing silly mistakes.
Mistakes,
So,
yes.
so that is why you have to time yourself. That, and you have to start preparing like that. Like in every 30 minutes, I'm going to do 35 to 40 MCQs, not more than that. If you're doing more than that, that means you are ignoring the questions and the points. If you're doing less than that, that means you have to increase your speed to get to that point. So first make a point that okay, in 30 minutes I have to do 35 to 40 questions, and I have to treat it as seriously as my main exam, and I have to be very fixed on my times. If you are able to do this, your GT scores will improve. And even after doing everything, there's still a plateau. So keep calm. Keep reviewing your bad points, bad topics. It will improve over a period of 1 or 2 months. It will improve. Okay. So don't worry on that.
Ma'am, what you mentioned about fatigue, like towards the end, because students are fatigued, they make a lot of silly mistakes. I agree, because it is difficult to sit for 200 questions, and for FMG, since there are 300 questions, it becomes a fire exam. So the chances of silly mistakes improves drastically. So
Yes.
what do you suggest students can do to maintain their concentration for a 5-hour duration, which is not
Not
easy? Like, even when we study within 1 or 2 hours, we start to see that we're losing focus, so we need a break. It's not really possible to do that in the middle of an exam. So what do you suggest students can do, like gradually improve their concentration?
everything completed. Not possible. That not humanly possible. So what you should do is whenever you are planning an exam, okay. So first realize there are some high yield question or high yield previous year topics which are always asked. So make a list of that. After that, keep on giving lots and lots of tests. Like if you're giving a test, let's say a 30-minute test now you've given seriously, and test doesn't mean that you have to you have to give a test at some platform or something. Even if you have not joined any platform, or if you are still, just take your book or take your there are so many ebooks available now. So give yourself time. Okay, so this is my anemia topic, I'm going to finish these 35 questions within 30 minutes, and put a timer in front of you. More you make your brain practice like that, you'll be able to sit over a period of time. After a point of time, you will realize that yes, my concentration is improved, my silly mistakes are decreased, and I am doing better.
Yeah, great. Thank you, ma'am. The next question I think is more of an opinion, but someone has asked, what do you think? Will there be next exam for 2020 batch? I don't think we can say conclusively, but what I think it is more of an opinion question.
We don't know. We still don't
Uh,
know. It is actually government's decision.
mm,
We will just have to wait and watch what happens.
okay.
Nobody can accurately say that till the time the order comes. So once the order comes, I promise you, you'll be the first one to know. I will post it first thing in the Instagram.
Right. The next question is, how can someone prepare for pathology or in general second prof subjects at that time for NEET PG?
So, okay, so that is a very, very important point to be realized, to be emphasized at this point of time. See, so so what happens is in the second year, whenever you are preparing, okay,
Hmm.
I okay, so I think whenever you are studying as a second year, the second year subjects basically. So the right time to start is always in whatever year you are in. So I would say the first best time to start is first year itself
Hmm.
for your preparation for your future life. Okay, so studying doesn't mean just preparing for the entrance. Studying also means that you have to understand the subject so well that if you give any exam in this world, it might be an USMLE, or it might be an Australian exam, or it might be a Dubai exam, any exam, okay, or it might be a UK exam, you should be able to clear it. Okay, so your preparation should be so well. So how to do that is, first you have to study the main textbooks. So there is no shortcut to books. So now I have heard students, okay, saying that, ma'am, the Robbins is a little tough book. We don't understand it.
Mhm.
So for that, you can take help of faculties like us
Mhm.
who are there, who keep on teaching you topics. Okay, so like my learning resources on doctororials, or there's so many faculties out there.
Mhm.
Whomever you find comfortable, you can take their topic, you can take their subscription.
Mhm.
And what happens by that is that the understanding of that topic becomes little easier.
Mhm.
I will not say that you should not read Robbins after that. You have to. because till the time you don't read the book, it doesn't go into your brain. So learning is a very complex mechanism. So in that, three things work together: your eyes, your brain, and your hands. Okay, so when you see or read something, okay, it goes to your brain. But when you write it, okay, yourself, when you write it yourself, it comes out and it stays there in the permanent memory forever. So therefore, when you listen something, okay, when you're listening a story or a subject topic from any faculty, what happens is you are enjoying that, you're understanding that topic. Okay, so it goes into your brain for one point. But the second time you should go and read that topic again. Okay. Reading will make you perfect. That concept will remain in the brain forever. And the second important point about reading from the book is you can also check whether the faculty is teaching correctly or not. That's also very, very important, isn't it? So you have to trust. So to trust the faculty, you have to read it and say yes, ठीक पढ़ाया था. Then that is also very, very important, no? So that is why reading textbooks is mandatory. Apart from that, I will also emphasize on this point that you should join a lot of quizzes and test series. You should start giving tests from very beginning itself, because that will make you perfect. For every topic you should study, you should give tests. You know why? Because that analyzes your knowledge. तो आपने पढ़ तो लिया, आपने concept brain में तो बना लिया, but you also have to evaluate yourself. And that is very, 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 very important. So I will really emphasize on this point that after you have uh, heard the lecture from somebody, read the topic from your book, analyze and evaluate yourself also, that whether I have understood this or not. So when you do all these three things together, you will be master of your subject.
So the takeaway is we have to read textbooks to make sure faculty is teaching properly.
Yes, that's super important. You have to check. How can you just believe? Human nature is a nature of suspicion. No, you should have high degree of suspicion. Sahi padhaya ki nahi? I'll tell you a very funny thing also. Okay, so usually, no, I also have a habit of writing when I study something. So I'll write, and I'll make some notes. Okay, I have written very nicely, I prepared very nice. Okay. After that, when I'm starting to revise, no, I start doubting. अच्छा ये मैंने लिखा था, ये सही है, गलत तो नहीं है. Let me check the book. This is correct. This data is correct or not? And I start checking it again. So being judgmental, being suspicious, is a very good nature. That's a nature of a good doctor or a good researcher. You should have lots of doubts, you should have lots of queries, you should have a lot of questions and lots of suspicion that ये ठीक पढ़ा रहा है कि नहीं. So that's very, very important.
And quiz ke matter pe, I'd like to promote that Vandana ma'am has a lot of amazing quizzes on her WhatsApp group, and so does Clinically Evolved. So make sure to join next time.
Yeah.
Ma'am, our next question is, someone is asking that they are in their internship year and they feel like pathology is one of their weaker subjects. What can they do at this point of time to make their core concepts strong or to better prepare for any examination?
Okay. So, like, if your core subject is weak, now this is a very, very important point that I will tell you. If your core subject, any subject for that, whatever is your weaker subject, you have to give more time to that subject. Okay. The only major problem with having a weaker subject, especially a major subject, a weaker subject, like pharma, path, okay, medicine, surgery. Yeah, these are gynae. These are major subjects. So these major subjects should be very strong. If ever your major subject is weak, okay, I will emphasize that you have to see, now you have to realize how much time is left with me. Okay, whether I'm very close to the exam or whether I have time. If you're very close to the exam, then what to do is, the only way to improve yourself is you have to give topic wise tests and start studying retrogradely and try to understand a major previous year topics. I'm not saying previous year questions, I'm saying previous year topics nicely. Okay, so whatever questions are asked previously, whatever topics are asked previously, you focus on that. Okay, for example, they ask you questions on lymphoma. Okay, so you know the question on lymphoma will definitely be there. Okay, so once you go through papers, you know that. So you know that what they ask in lymphomas is that which is the translocation which is most common in any lymphoma, or they will ask you that special type of cells they will give you, like Sézary cells or flower cells, and they'll ask you which lymphoma, or they'll ask you some new update on that lymphoma. So you know that lymphoma topic is going to come for sure. So what you do is you have done a test question, you have seen 2-3 questions on lymphoma. Now you make your gist chart. Okay. And on that gist chart, you write all the lymphomas and you write important salient points and stick it on your wall. Once you stick anything on your wall, every time you're just going on a room, you see that. And believe me, it becomes imbibed in your memory. So I can see a lot of a lot of stick-ons behind in your wall also. So that's a very good strategy. I'll say excellent strategy. Your wall should be full of stick-ons. Okay, whatever you are studying, write it down and stick it on your wall. So anybody entering into your room should look like where I've come. Okay, and keep revising that again and again. So make your core subject stronger by that. Give it more time, write your points, and do it. And if you have, this is when you have less time. When you have more time, then start from basics, start understanding the concepts, read it well, and start doing questions. Like that.
Okay, ma'am. Ma'am, the next question is, since we are 2 months away from NEET PG exam, my notes are very bulky. I don't know what to study, how to revise, and proceed.
So the most important point in succeeding is revision. Even if you have studied something which is like 5 years, 5 months back or 6 months back, you're not going to remember that on your exam day. So the most important thing is concising your notes. That's the most important thing. So how do you do that? Is analyze. Ki bhai, when I'm doing my tests, I'm like, let's say apoptosis. Okay. So I always mark all the questions of apoptosis correctly. So that apoptosis should go out of your notes. Okay. So you know you're doing it correct. So it is fixed in your memory. Okay. So now whatever notes you have made, okay, start, tearing them. The time of tearing comes 3 months before your exam. Okay. So make 2 copies of your notes. One is what you know nicely. Second, what you don't know nicely. So when you don't know nicely, जिसके आपके बहुत सारे questions गलत हो रहे हैं, बार-बार गलत हो रहे हैं. So take out those pages and keep it separate. And put clips on it. Okay, you don't need a binded copy or something like that. Put clips on it. That these are the topics I don't know. I have to revise this at least 3-4 times. And these are the topics which I know. So I don't need to, revise it so many times. I will only revise it one time before my exam. So that's how your notes will become concised. After that also, in that notes also, which I've made कि जो नहीं आता है, उसमें से भी when you're giving tests and you start feeling that, okay, now this topic has become stronger, keep moving these pages to the other note. So automatically this note, which you don't know, will become less and less and less bulky, and it will be more and more and more easily revisable. So,
Okay.
so start tearing your notes. There's no problem. Tear your notes, stick on your walls, do whatever you wish to do, because
Right.
yours is
Ma'am,
life.
the next. Yeah. Ma'am, the next question is, how should we go into a GT? In the sense, like, how should we attempt an MCQ? Just we say कि MCQ में the best way to attempt it is by elimination method. It helps you come down to the best answer. So, is this the only method, or are there other ways to look at an MCQ, especially when you don't know the answer, or especially when you're stuck between 2 options? What should be the strategy then?
See, there'll be a lot of times when you will feel that whenever you're giving your GTs, you'll be stuck between the 2 options. Okay. So there will invariably be that kind of questions in which you are stuck between the two options. So how to solve that is, I'll tell you a simple way of it. Okay. So the thing is, let us say I am giving you a question, let's say 59-year-old male, asymptomatic male came with fatigability. On examination, he has cervical lymph nodes and peripheral smear of the patient is shown, and it's showing smudge cells. Okay, so what staging do you do in these kind of patients? So this is a tertiary level question. That is, I've given you a history, I've given you an image, and I'm now asking you. First, you have to identify the diagnosis, and you have to tell me what is the staging. So now there are a lot of steps in this question. So this is a complex question. Okay. So how to sort this question is that first, line by line, emphasize on the history. So now you know that looking at this is a leukemia question because peripheral smear is showing, smudge cells is shown. You know it is probably CLM. But when you're making your notes, okay, make a note of all the leukemias: acute leukemia, chronic leukemia. Acute leukemia, what are the types? It can be lymphoid, it can be myeloid. Okay. In chronic, I can have CLPD and CMPNs. Okay, chronic myeloproliferative neoplasms. And make a note, and history wise, you start making separate points on each thing. So asymptomatic leukemia, एक ही होता है, CLL. Okay, so looking at the first question itself, I know it's a CLL. Everybody will know CLL. Now, when you're making a note, there itself you should write staging for CLL is Rai and Bennett. If you're not able to answer this question at the first go, okay, then, and if you did it wrong in your GT, mark and write that in your GT notebook forever. So that next time that question comes, you will not do it wrong ever in your life. Okay. So the only clue to get out of two easy options is revising that topic, understanding that topic, and attempting the question again. That will help you solving the GT. Okay. Now, once you have taken more time for that question, next time you should be clear that I'm not going to spend so much time on one question. Okay, I have done this wrong in my GT. I didn't knew this. Next time इस टॉपिक में से कुछ भी आए मुझे आना चाहिए. तो CLL के जो जो क्वेश्चन पूछे जाते हैं, whichever have been asked in the past 5 years, write it down there itself. This is the IHC marker. This is the flow cytometry marker. The next investigation should be flow. Okay. Everything. It is one of the common leukemia with autoimmune manifestations. So write those points there itself. So that whatever question comes, you are able to answer that. So the key to succeeding a GT is a deep knowledge of the topic, and especially majority of the GTs rotate around previous year questions, previous year topics. So make your previous year topics stronger. Give yourself give yourself timing. Put timer in front of you when you do the GT, and review your wrong answers thoroughly. You will definitely do very good in your exams also.
Ma'am, the next question is, how do we manage both university exams as well as preparing for NEET PG simultaneously? Like, should we start attempting MCQs when we are studying in second prof itself or later on during internship?
See, one point is very clear. If you are reading your concepts nicely, if you are attempting as in the second year, somebody, I think Ankit also asked this question while in chat, I was able to see that should I do question wise, topic wise MCQs in second year? Yes. The answer to this is yes. You should do topic wise MCQs after every topic is finished. See, in university syllabus, okay, whenever the faculties teach, the curriculum, the NMC curriculum is made in such a way that there are very small topics which are covered in every class. So a class will be like how much? Like 50 minutes, 1 hour class max. Okay. So usme there is only one small topic that they are covering. So let us say hemolytic anemia. So only hemolytic anemia they're going to cover in that 1 hour time. Okay. So now you have a lot of time before the next class you have heard from the faculty. Now you make a note of that and you do questions of that. Now You know that in previous year university exams, the question that is asked to me is either thalassemia or sickle cell anemia. Okay, so you when you're making your notes, okay, write detailed notes on these two topics. Okay, so that you know that these are the two university questions that are coming, because university questions are usually fixed. Okay, so you have to just see 10-year papers and those are the questions which are asked, because वही आता है, वही planned है. Okay, we know faculty wants to pass everybody. So there's a very, very good saying, a faculty, a teacher wants to pass everybody. For getting failed, you have to put a lot of effort. That if I have to fail, I have to put a lot of effort to get failed. Nobody wants to fail you. So therefore, we usually the questions that are put in university exams are the questions which are very frequently asked. So there is only very limited questions that come to you in your university exams. There'll be a problem solving question, which is every time they'll ask you myeloma. घुमा फिरा के myeloma पूछेंगे ही पूछेंगे. You know it is going to come. So make notes of that topic ready, no? And you have full year. In that full year, you have to just study the limited topic questions that are going to come. So what are you going to do the rest of the year? You have to prepare well, no? For the future, you have to make your concepts nice. You have to do a lot of questions. So that you should do, obviously. You can't waste it. Of course, I'm not saying कि in second year you should not do मस्ती. मस्ती करने का सबसे best time second year. Enjoy करो. It is one of the best times of your life. But make your schedule. Make your schedule in such a way that you enjoy also, and you study also, and you do everything. And obviously, you are best in, who becomes a doctor? The top cream of the country. You are already the top cream. So decide. You have brains. So decide accordingly. Divide your time. Studying, enjoying, studying, enjoying, studying, enjoying, like that.
Yes, ma'am. Ma'am, in the beginning, when you were talking, you said that at your home you didn't have like the right environment, in the sense like proper guidance or the right atmosphere. We have a similar question where someone is asking that they're from a deemed medical college and they feel like they want to prepare for NEET PG, but they're not able to find the right friend circle or the study partner, or in general, the atmosphere where everyone is preparing or that the competition is good. How can they deal with a situation like that, that self motivation is there but the circle is not there? How do you think, what could they do in a situation?
I can really understand your pain in this situation. It is definitely a difficult situation, I would say, because when you have a good peer group around you, okay, when everybody around you is studying, okay, you get a motivation. अरे वो पढ़ रहा है, मैं नहीं पढ़ रहा हूँ यार, ऐसे कैसे यार, इतना बुरा हो रहा है यार मेरे साथ, बताओ वो लाइब्रेरी जा रहा है, मैं नहीं जा पा रहा हूँ. So definitely that peer pressure definitely comes, okay. But suppose if nobody is going, nobody is studying, everybody is enjoying, you feeling यार मेरे को ही पढ़ना है. So then you have to motivate saying that I have to get out of this place. You have to say that I have to leave this place and I have to get a good rank so that I'm out of this place. So there was a student whom I know. Okay, he also was from a deemed university, and whenever like he used to ask some doubt or he used to tell me, so I always used to just ask, okay. So after every question or everything he asked me, after that he used to write, ma'am, I want to study well because I want to uh, get out of this place, and I want to reach aims. So I used to say, okay, very good. So that should be a motivation. So every time he used to get demotivated, he used to say, ma'am, put a difficult question for me, so that I cannot answer. So I will feel little bad and I'll start preparing. And why? So he used to say that, ma'am, because my only motivation is that I want to come out of this place and I want to join AIMS so that I have that tag with me forever. So, or that is what drives you. Okay, so like my motivation was, I always used to think that no, I have to do something big in my life. So my motivation was this. Okay, so I wanted to prove my dad wrong. My dad used to say, BA कर लेना उसके बाद शादी करा देंगे. I said, what is this? अब तो बिल्कुल आप गलत prove करेंगे. अब ऐसा नहीं होगा. So my motivation was to prove him wrong. So you should search for your motivation and you should work for that. So I think motivation, you have to drive the motivation from within yourself. When you drive the motivation from inside, there's nobody who can break you. So that is what you have to develop motivation, because everybody doesn't get a good atmosphere. I can understand that, but you have to drive the motivation from within you. Saying, okay, and nowadays, so there are so many things, no? So you're giving GT, you get a rank, which is not good. So you feel, no, I have to get a good rank. Or if you're doing, if you're joining on Instagram, there are so many posts which are coming, and you think, oh, this topic I didn't knew, I have to study. So nowadays, so you have to motivate yourself. If you get a peer group which is studying with you, very good. If you're not, you have to think. Alexander एक ही था जिसने दुनिया को जीता था. So you have to be that single man army.
Yes, yes, definitely. Ma'am, in one of the earlier questions, you said ki, matlab day by day schedule, what it should be like. The next question is that close to the exam now, first reading is done, but abhi revision karna hai. So revision ka strategy, what should be the strategy for the revision? Like how many revisions should be done in these 2 months, and how many days should be given to what subjects? Like that breakdown.
So as I told you, 3 revisions ka target you should have. You have to revise 3 times. And I told you always, like whatever notes you have made, start tearing them up now. Okay. When you're revising that, you know that this topic I know very nicely. You can tear it and keep it apart. And some topics are there which you feel that I do mistakes in it. Like cystic fibrosis, like question aa raha hai. Okay, I am doing this question wrong again and again. I have to revise it. So I'll keep it aside. Okay, next time when the question comes, and if I do it again, I'll again see it. So you have to revise it 3 times, but first you have to identify your weaker areas. That topic should be revised more, and your stronger areas. ऐसा नहीं कि stronger को छोड़ ही देना है कि भैया वो ही weaker बन जाए. So stronger को भी revise करना है, but then you have to give more time to the weaker ones, and the stronger one can be given lesser time. But that lesser time should be near the exam, like 1 month before the exam, like that.
Okay. The next question is it compulsory to go for standard textbooks, or can we refer to Indian authors as well? For example, KDT for pharmacology.
Yeah, I think, see, any author, it doesn't matter that you should only go for international books. No, it is not necessary. If you're like, there are some books, the KDT for is a very good book. Okay,
Yeah.
so if you're reading that and if you're understanding that, why not? And only thing is, just reading one book is not enough. If you're reading one book, you have to solve questions. If there's some questions which you're not able to answer, or some topic which you feel is not, I'm not able to understand from this book, go to the another standard book and read. And what is there nowadays? You have e-copies of every book available. So you mark the topics. Ki bhai, this topic is given nicely in this book, so I have to study from this. This topic is given nicely in this textbook, so I'll study from that. So you have to mark and you have to write in the index itself that this topic I have to study from this textbook. So yes, why not? Follow the book which you find easier to read, and which you are able to say solve majority of the questions.
Right. The next question is must know topics for NEET PG. I think this is a general question, but if you can answer for pathology, then that is also enough.
Must know topic, I'll tell you at least 10 must know topics which are mandatory to be known before your exam, for any exam. Okay, so something called as my jinx questions. So always, yeah. The most important topics are the topics which you have not read well. So examiner knows that कि ये तो नहीं पढ़ा होगा इन्होंने, हम इसी से क्वेश्चन देंगे. So those topics you have to read well. Okay, so the first one is number one, genes. Okay, so genes should be known well, their positions, whether they're oncogenes or tumor suppressor, and the cancers they cause. Okay, then all the hemolytic anemias, कौन सा intravascular है, कौन सा extravascular है, कौन सा old age में होता है, which is complementopathy, that are all hemolytic anemias. Then all the leukemias, as I told you, acute कौन सा है, chronic कौन सा है, symptoms कौन से हैं, everything should be known to you. Okay. Then apart from that, hepatitis, all the type of hepatitis, they ask you morphology wise, question wise, everything should be known to you. Hepatitis, brain tumors. Brain tumor is one topic which will be invariably be asked. They know you have not read it properly, so they'll ask you childhood tumor, rosettes कौन से किस में मिलते हैं, including eye, okay, retinoblastoma में कौन से rosets मिलते हैं. So that is another topic. Then blood banking. They know blood banking नहीं आती, नहीं पढ़ा इन्होंने. So blood banking is one topic from which definitely a question is going to always be asked. Then the mechanism of inflammation. They'll ask you कौन सा है जो margination कराता है, chemotactic कौन सा है, phagocytosis में कौन help कराता है. So that mechanism of inflammation is again a very very important. Then all the type of nephrotic and glomerulonephritis with morphology, okay, minimal change कैसा दिखता है, FSGS कैसा दिखता है, everything in kidney, especially diabetic kidney कैसी होती है, SLE kidney कैसी होती है. So this should be known, okay. Along with that, renal cell carcinomas, all the renal cell tumors, both in adult and children. Adult का renal cell carcinoma, children में Wilms tumor. So this should also be very very nicely known. Then lung में lung tumors, okay, lung tumors and all the occupational lung diseases. Silicosis कौन से part को involve करता है, asbestos body कैसी दिखती है, okay, all that along with the lung tumors, okay, they are very very importantly asked question. And the last, soft tissue, okay, we ignore this topic and invariably आता है soft tissue and muscle, okay. So soft tissue tumors, lipoma कैसे होता है, FNAC में कैसा दिखता है, okay, and muscle, Duchenne's muscular dystrophy, which gene is involved, okay, parking lot inclusions किस में होते हैं. So these are 10 most important topics from which invariably the question comes. And 11th also I'll tell you, amyloidosis. So amyloidosis is the next very important topic from which the questions invariably come. So these 11 should be on your tips, okay. You should know this, right?
Right. Next question is, how should someone deal with a subject that is very dense on facts? Like, I'll take patho only for example. Like, patho has concepts and facts both. Concepts, once you know, it's very difficult to shake it. But facts is such that you study today and then maybe you won't remember it 1 week down. Like markers in patho, if you take for example. So what can we do to keep revising them? Because it's not just patho, there are so many subjects that one has to remember. How can
So
we go about with that?
your wall is the answer to that. Revision is the key. Post it on your wall. Whatever marker you don't know, keep it on your wall. Pass. किसका stain है? Okay. Alcyon blue किसका stain है? Write it and paste it on your wall. Invariably you will remember. You write it and do it. Invariably you will remember. So whatever you don't remember, write it on your wall and stick it. You will remember it. Take it from me. Message me after 1 month if you don't remember.
Yes, ma'am. And another thing is, there is this notion with respect to FMG exams that questions are more superficial or more fact-based. So is there truly a difference between strategy if one is to prepare between FMG or NEET PG exam? Or it's same only, more or less, in your opinion?
No, that's not same. It's very different. So FMG and NEET PG exams are very different exams. Okay. So FMG exam is basically a kind of a screening exam. Okay. That they're just wanting to screen to take the FMGs into the mainstream. Okay.
Right.
So it's basically just a screening exam. So majority of the time they will not go very deep into the concepts, or very very deep or very tough questions will not come. So they will usually ask the questions which are very practical, like what is the gauze size of this needle, what is the order of draw, which vacutainer should you use for collecting the sample, or very simple like which is not a nephrotic syndrome. So they just want to, so the main intention for the FMG exam is they want to take FMG students into the mainstream. For that, they do a screening exam, so they don't make question paper very tough. Okay. So the last time question paper was little tougher than the all the other time, and the reason for that was that they felt that okay, majority of them are studying only a fixed prototype. So let us deviate a little bit from the fixed topic. So that is what they did, and the exam was little tougher last time. Yes. But majority of the time the exams are not like that. The FMG exam is a screening exam, and it is basically the intention is to take them into the mainstream.
Okay.
So it's not a very very tough exam. Okay. So and there are fixed topics usually from which the exam questions come. So those questions should be read well. Okay, and you should be practicing. So invariably there will be some questions which nobody will know. Okay, because वो बहुत नया होता है. So you have to accept that there will be approximately 5 to 6 questions which nobody will know. So when you don't know, ignore those questions. You know that nobody will know. It's a screening exam, and I have to get the minimum percentage to enter into the system.
Correct.
Okay, so that's about FMG. What about NEET PG? NEET PG is also a screening exam only, but the point is, it is a rank based exam. So it is basically you have to choose your branches on the basis of that. Everybody gets qualified. Qualifying is not a difficult task in NEET PG. Everybody will get qualified. The main crux of NEET PG exam is ranking. So you want a subject of your choice. You have to get the rank of your choice. For that, you will have to put an effort. So in that, the number of tough questions are more. Okay, so agar FMG mein there are only 10% which are tougher, in NEET PG the tougher proportion goes to 25%.
Correct.
So that they have to decide the rank. If they don't do this, then everybody will qualify. But how it will be very difficult to decide the rank between a good student and an average student. So for that, they keep some proportion of the questions which are tougher, which only good students can solve, and so they get a better rank. So that is the difference between NEET PG and FMG, and that's what we have to be clear on.
Yeah, right. Ma'am, that's the end of our queries from our students, but we'd like to know more about you as a person, as a teacher, and as a student also. So I'd like to know about how you got into teaching and when did you discover your passion for this?
Okay. I think when I was a child, okay, I have a younger sister, okay, who is 5 years younger to me, okay. So when I was in my ninth standard, no, I remember for the first time we had to study malaria, okay, Plasmodium falciparum ka life cycle. So that was the first time I had a board at my home, okay, chalk and board. So I was not able to remember it. Whatever I did, I forgot it. कौन सी stage कौन सी है? I never used to remember it. So I called my sister, who was 5 years younger to me, okay, and I told her, "You sit here. I will teach you." Okay. Today I am going to teach you the life cycle of Plasmodium falciparum. And she was looking at me like this, what this nonsense is going on. So I was saying, no, no, you have to listen to me. You have to listen to me. I'm going to teach you very nicely. And I told her such a story कि ये एक मच्छर होता है, इसके अंदर ऐसा होता है. And she was so happy about it. She said, दीदी आप मेरे को ना रोज ऐसी कहानी सुनाया करना. That was the day I felt, अरे I love teaching and telling stories so much. ठीक है यार, कल मैं तेरे लिए एक नई स्टोरी बनाऊंगी. So that was the beginning when I realized that yes, I enjoy teaching, and I love teaching, and I love telling stories, and those stories will be so stupid that if you hear it, okay, you will say, what is this? There's no head, no pair, nothing. I'm just telling what story she's telling. But somehow, no, you will remember that story. That will
That is
definitely be there. You will remember that.
remember. Make your mnemonics like so stupid that you end up remembering them
Yes.
because that
Yes.
is how
And
it
you'll remember that.
yeah.
And this is the one thing I met my husband also. He was my boyfriend, okay. So whenever he used to not remember anything, no, suppose a very difficult passcode is there and he's not remembering it, some very difficult password he's not remembering, he was like, कोई स्टोरी बना दे यार इसकी, फिर मुझे याद हो जाएगा.
Wonderful. Ma'am, why did you choose pathology? Because there is like this very like particular stereotype कि non-clinical branch क्यों लेना है या फिर ऐसा क्यों लेना है, like scope नहीं है इसका. Usually people say go for clinical. That's the notion. So did you also hear these things from your peers or your family members? And why did you end up on pathology?
Okay. So first thing is pathology is now a clinical branch according to the NMC curriculum. Okay, so that is one thing. Now, second thing is, yes, there is a stereotype, definitely. As I always tell you, my dad was very against. I had a very good rank in my entrance. So when no, I am going to take it. Whatever happens, I'm going to take it. So, how I got interested in pathology was that there was a professor in my second year MBBS, and we used to call her Bullet. Okay, because she used to, she used to teach so well, and she used to, the way she used to dress up, her personality and everything inspired me a lot. That was one thing I got inspired. Second, when I started studying pathology, and I realized the basis of all the medicine is pathology. So I at that time, during MBBS, we don't have much exposure to pathology. So I didn't knew as a branch how pathology is going to be, and what all things are we going to have, because we didn't had any exposure कि pathology होता कैसा है. So then when after this, when I was in my internship, I said no, I can't work so much. Okay, I want to enjoy my life also. So definitely I'm not going to take a clinical branch, especially who makes you, especially gynae, who I can't do that much. I can't do that much work. So I want to enjoy my life. Okay, so I should not die saying that doctor ban ke galti ho gayi. No, I have to enjoy my life. So that was the third reason that I said pathology लेनी है. So these are the three major reasons that I thought that I'm going to take pathology. Then when once I took pathology, one of my senior residents told me that pathology का तो scope ही नहीं है, तूने क्यों ले लिया, तू पागल है, second counselling में change कर लेना. And then I realized that then I thought कि ब्रांच तो ठीक ठाक ही है, मतलब ऐसा इतना इतना नेगेटिव है इसके बारे में तो क्या क्यों है. Then I realized that there are very less jobs in the market. So because jobs are less, so people are reluctant in taking pathology. Not that people don't love pathology as a subject, but because they don't get jobs after they pass out. And that is why the market is very negative about taking pathology. So that is what I realized was a problem. And I have to say that the second problem that occurs in pathology, why people are very reluctant in taking it, is they take up thinking that it is a cool branch, but when they join it, they realize it's a very hectic branch. So there was a student who joined AIMS recently. He told me, ma'am, I thought it was going to be 8 to 4 job, but we come at 7 and we leave at 12 o'clock at night. What kind of cool branch is this? I could have taken clinical if I knew this was it. So it was a shock for him. So pathology, you have to read a lot, you have to work a lot. That's another part of the pathology. That's why people say that हमने cool समझ के लिया, ये तो cool ही नहीं है, तो क्या फायदा. Plus out बाहर निकल के jobs नहीं है. So the jobs की problem is because the corporates have entered into the market. So there are big chains which are there. So and these big chains do not take more pathologists. So they take only very few pathologists, and majority of the machines are automated. So everything gets automated. Pathologists are required to sign. So that is why the jobs are little less in the market. So all this together has created a lot of negative environment around pathology as a branch. I think times might improve. And the third problem, is that a lot of technical stuff, okay, a lot of technicians also open up their own labs and sit, and the general public doesn't know. So that they are the another set of people who are eating up the jobs. So all this के कारण there is a lot of negative, negative aura which rotates around pathology. Otherwise, if you're looking at the scope overall, yes, you have a good teaching scope. You can become a professor in a medical college. There's a lot of research facilities also there. But the problem is that we in India, we don't have so much research positions. We have, but only in apex centers like AIMS mein hai. But other places do not have much research jobs. With the molecular coming up in a wider way, molecular is coming up in a big way. Now, no diagnosis can be made without molecular diagnosis. Even your WHO 2022 hematology, everything is molecular. Tell you, uh, I love reading Sidney Sheldon's novels. They are my favorites. So I love that.
And
And of
which is
course,
the first profession that you wanted
Ikigai
to
and
be?
all that is also there. But yes, I'm a novel. I am a novel person. Yeah.
Okay. Which is the first profession that you ever wanted to be, or did you always want to be a doctor since the beginning?
My mother says when I was 5, I told whoever asked what I want to become, I used to say I will become a doctor.
Oh, okay, wonderful. And what is your New Year's resolution for
New
2024?
Year resolution
Mm-hmm.
that I should be healthy, and the only resolution I have, I should give more time to my health, and I should travel more.
Okay, wonderful. And last question that I have for you is, what is your favorite memory as a teacher?
So many memories I have.
Favorite is very difficult to read. Yeah. So I remember when, when I was going to join AIMS, they were, it was a COVID time. So my Harding girls gave a very beautiful farewell to me on digital media, because that time it was a COVID time, everything was
Mm-hmm.
closed. And the way they made the cards and songs and everything was digital. I love you girls for all of that, and I will never miss that. And that is my fondest memory as a teacher, and any teacher can have that. To all my girls who are hearing that, that was
A beautiful, beautiful message uh, from all of you to me. Thank you.
That is wonderful, ma'am. Thank you so much for joining us today. I'm very sure it was very beneficial for everyone, especially so close to NEET PGs. People must be so stressed and worried. And having mentors like you who ease things up for us, it is very, very important. Thank you so much for your time. And thank you so much, everyone, for joining us. We'll see you all again at another live. Thank you, ma'am.
Thank you so much. Bye bye.
Good.
And thanks for
Bye.
inviting me. Thank you. Bye.